From classroom to cafeteria, exploring the effects of interactive health education approaches in school. So my EBP group consists of Celine, Janae, Crystal, Demetria, and myself, Courtney. Here's a brief table of contents that consists of our Step 0, Spirit of Inquiry, Step 1, our Peacock question, Step 2, Search, Step 3, our Critical Appraisal, Step 4, How we integrate our evidence, Step 5, Evaluating outcomes, Step 6, Disseminating results, and lastly, our reference page, which has all of our references. America has one of the highest obesity rates, but why is that? Our group came up with the idea that the rise of obesity is mainly due to the lack of knowledge regarding nutrition and fitness. One of the huge things about nursing interventions is prevention. So our goal is to see if early intervention can prevent these chronic illnesses. So a few things that we notice is unhealthy diets contribute to obesity, which is a global health issue. So engaging parents in promoting healthy habits in children seems like the first step to educating these people in the earliest stages possible. So as a group, we're looking for effective strategies for promoting healthy habits in children. And we want to see the impact socioeconomic factors have on health outcomes. Step 1, our Peacock question. So our Step 1 Peacock question goes like this. Among children and adolescents attending local schools, how does implementing interactive health education programs compared to standard health education curriculum affect the adoption of healthy eating habits and increase physical activity within the academic school year?
While searching for articles to support our Peacock question, we use keywords such as health education programs in schools, the effect of health education programs in schools, the effect of health education programs on healthy eating habits and physical activity, as well as health education curriculum effect on healthy eating habits and increased physical activity.
My article was a study that aligns with Sustainable Development Goal 17, emphasizing partnerships for development by showcasing collaboration among government, industry, and academia to implement a nutrition intervention aimed at enhancing the nutritional status, knowledge, attitude, and behavior of school community, including school children and mothers. Using a quasi-experimental design, the intervention comprised school lunch feedings and nutritional lessons. Data analysis was conducted using Stata 12.0 with descriptive statistics generated through survey module. The intervention combined the government partner school feeding program, SFP, with a nutrition education campaign. The SFP provided standardized lunches to ages 7 to 9 years old, while nutritional education component involved teaching modules for students and mothers. Results showed improvements in nutritional status, knowledge, attitude, and behavior among students. By investing an average of 29 cents per day USD in the school feeding program, the intervention reduced the number of overweight children by 25.3% after 120 feeding days. The study emphasized multi-sectional collaboration through the implementation and post-implementation phases. The partnership among stakeholders facilitating healthier outcomes was as evidenced by improved nutritional status, knowledge, attitude, and behavior among participants.
The study evaluated was a randomized controlled trial focusing on overall health in children ages 11 to 13. The trial was named GOAL and had parents as well as school follow and enforce healthy eating habits, exercise, and address psychosocial factors related to healthy lifestyle. After the 12-week trial, there was a notable improvement in the adolescents' BMI, which lowered the potential risk factors for these children.
In the study design that I chose for our project, a total of 24 articles were included for review and 11 articles in meta-analysis for school-based food and nutrition education interventions on adolescent food consumption for children aged 2 to 19 years old. The evidence available in this review and meta-analysis concludes that food and nutrition education interventions in school presented favorable results in the food consumption of adolescents. The school is a favorable environment for the development of interventions to prevent obesity and create healthier eating habits, and as well as increased physical activity.
My article study design was a randomized controlled trial. The intervention was a diet-related and lifestyle education program. It was implemented on young teenagers, ages ranging from 11 to 13 years old, and it was a total of over 1,500 children. There was an education group, and there was a control group, and the education group was placed in the program that lasted 3 weeks. The findings may contribute to identifying teenagers at risk for excessive body weight and determine predictors related to diet, lifestyle, nutrition, knowledge, and attitudes towards nutrition.
When addressing the specific demographic of children, it's crucial to acknowledge their strong attachment to familiar comfort foods. This fixation often shapes their dietary preferences. Therefore, implementing a health program in local schools that recognizes and adapts to these preferences is paramount. By offering healthier versions of beloved foods like fried chicken nuggets, schools are effectively influencing children's eating habits towards healthier options, fostering positive long-term dietary habits from a young age, ultimately benefiting them in their long-term health.
Step 5, evaluating outcomes. After implementing a health education program in local schools, we propose measuring our outcomes through distribution of surveys to parents via email so we can ensure our participants complete the survey, followed by comparative analysis of the results. Step 6, disseminate results. 3 ways we can disseminate results is 1, UT Tyler nursing students should collaborate with local schools to deliver health education courses. Number 2, setting up a booth in a health fair with elementary students and middle school students. Number 3 is we could ask parents to attend a program so they could learn healthier recipes.
Thank you so much to listening to our EBP presentation. And if we can leave you with anything, it would be this quote. And it says, teaching kids to count is fine, but teaching them what counts is best.